Hey, it's Dr. Nina here at the Barefoot Rehab Clinic in downtown Denville, New Jersey. Have you ever heard of tennis elbow? I mean, who hasn't, right? What tennis elbow actually is something going on with your lateral elbow here. And a lot of things besides playing tennis can cause tennis elbow, including playing certain instruments like the drums or the guitar even, doing frequent work with your hands, being a mechanic and kind of driving the wrench, or anything that you're using your forearms and your hands to do a lot of work and a lot of motion with and moving that elbows a lot can cause you to have lateral elbow pain. And as a matter of fact, 2% of the world's population and 2% of the population in the United States approximately has chronic lateral elbow pain at any given time. That's about 6.5 million people in the United States alone every single day that are suffering from lateral elbow pain all the time. And here in New Jersey, that's about 200,000 people, 2% of New Jersey's population. So who we have here is Crystal. She's one of our clinical assistants here, and she does have a little bit of lateral elbow pain from time to time. And that's because she actually rides motocross, right? So she's in this position all the time, right? And she's got to do this, and she's moving her elbows, and she's taking brunts when she's taking jumps and things like that. So she does have some adhesion here in her lateral elbow. And the way that we check for adhesion that affects the lateral elbow specifically is by targeting the extensor muscle group. So the extensors are on the back side of your arm here, right? We call them extensors because we extend our wrist. These muscles help us extend our wrist upwards, right? Extend our forearm upwards. So these are the extensor group of muscles. And the way that we check for adhesion in these muscles, and the way we also treat them, is we always use our lotion. We got to lubricate the tissue because we don't want to cause, painful friction on the skin whatsoever. We want the tool that we use to glide. This tool is not sharp. It's very rounded. It's smooth. It doesn't cause any sort of severe damage or pain or anything like that because it's not sharp at all. So we come here and we look at the extensor group of muscles here. We have all these extensors right here. And then we just use the tool and glide along the extensors. Make sure that she's making kind of like a fist. And we're gliding along here. And I'm feeling, with the tool in my hands, I'm feeling the crunching. And that crunching is consistent with adhesion. So what is adhesion? I'm sure you've seen plenty of our videos where we talk about adhesion, right? So adhesion is basically a glue-like substance that forms in the tissues of the body, the muscles, around the tendons. It can form around the nerves. And it's most